Hello everyone, I am Amita from NourishDoc, a platform for natural and holistic therapies. We are going to be talking about menstrual health. We are talking with Dr. Floyd. She is an acupuncturist who will be joining me in 1 second. And hormonal imbalance that happens, especially in young women when they start with the menstruation. Hello, how are you, Dr. Caroline?
Hey, I'm good. How are you doing?
I'm doing great. Thank you so much for joining us.
Thank you for having me. I'm really excited to talk about menstrual health today.
Yes, well, yes, I think it's such a sensitive topic, and especially for young girls when they're getting their menstruation. Before we start doing that, maybe you could tell us a little bit about yourself, and then we can dive right into the questions.
Sure. So I am Dr. Floyd. I am a doctor of acupuncture and Chinese medicine. I'm located here in Sacramento, but I do virtual consults kind of all over. Um, and my specialty is menstrual health and also fertility. So I often treat fertility working on menstrual health and hormone balance. So my whole kind of thing is hormone balance and optimizing hormone balance. And then I also treat lots of mental health. And I do this by acupuncture. And I also have my own herbal line, Dr. Floyd RX, that I involve in treatment as well.
That's amazing. That's amazing. Well, let's start with the hormonal imbalance that happens when the young girls start with the menstruation, or even when they are past that menstruation age.
Yeah, so there are so many components to hormone imbalance, and I think that what we're seeing now is that more people are like tuned into hormone imbalance and kind of want to know more about it. When I
Yeah.
was in acupuncture school 7 years ago, I didn't know before going to acupuncture school that having like painful periods, irregular periods, um,
Mhm.
heavy periods, clotted periods, I didn't know that that was all indicative of an underlying hormone imbalance. And
Okay.
so more I started researching and specializing in reproductive medicine and hormone health, the more I realized that like something is something is underlying all of this, and I need to
Mhm.
think
Mhm.
about this.
Yeah.
How you know that if you're experiencing hormone balance, it has kind of menstrual health consequences, but also you'll see the symptoms in your overall health. So things like bloating, fatigue, low energy, mood swings, depression, all of this can be indicative of hormone imbalance. And then cycles, kind of already what I mentioned, but irregular periods, heavy periods, painful periods, any
Mhm.
sort of period symptom that you are not wanting to have, that's indicative of hormone imbalance.
Okay, so like I know in Chinese medicine there's a concept of tongue diagnosis, right? So
Yeah.
is there a way? I know is there a way that you can also tell by the tongue diagnosis along with the health of the menstrual period, or is it like how would you say, like it's some women might have clotting, some women might have darker shades. I mean, is there something like how? What I'm trying to understand is, how you have tongue diagnosis and the tongue could be thick and the big and all that, and that correlates to this problem. So similar to that, is there something with the health of the menstrual cycle or the blood that comes out? Is if it's clotty, you're going to have pain, or if it's like darker shade, you might have bloating. Is there some correlation to that, or is it like?
Yeah, that's a really, really good question. So, just for people who are listening who don't know, in Chinese medicine, we have two kind of main diagnostic tools. One is we feel your radial pulses,
Yeah.
and the second is that we look at your tongue. So people are always like, wait, you want me to stick out my tongue? And then they tell me
Yeah.
everything they had to eat that morning, and they get embarrassed and things. But we look at the tongue to see what your underlying like constitutional pattern is what we call it. So you can see from based on the pattern of the tongue, I can make like a pretty accurate guess as to what your menstrual cycle is going to be like. So you mentioned bloating. Typically, when you have like bloating or indigestion, your tongue coating is going to be thicker. So if you stick
Okay.
you're going to have like a thicker white or yellow coat. And that's because you're not able to digest your food properly. And so it shows up that like coating, the indigestion on your tongue. So people that have tongues like that, typically they're going to be like more bloated premenstrually or even just in general, feel like they're not digesting their food properly. You mentioned clots. So typically, clots in Chinese medicine is indicative of what we call blood stagnation, meaning that there's not like free flow of your circulation. Um,
Mhm.
So on the tongue, that typically shows up either like a pale or dusky purple tongue. Like your tongue is a little bit, yeah, it's a little bit, it looks like a grayish purple. And then you'll
Okay.
see some dots on the
Yeah.
tongue. That's
Yeah.
the blood stagnation. PMS is going to be the same. You'll see dots on the side of the tongue. So yeah, take a look at your tongue if you're watching this, and you'll kind of see like what I'm talking about.
No, I think that's what is so fascinating, that just by looking at the tongue, you can, you can correlate the menstrual health of,
Yeah.
and that's what I find it so fascinating. So what would be like, let's talk about a little bit tools, so if someone is having hormonal imbalance and having issues with their menstrual health, what would be the tools that you would use as an acupuncturist to help that person, get relief?
Yeah, so it kind of depends on what the patient is coming in for, but overall, I do a lot of like lifestyle changes, diet changes, and then of course acupuncture and herbs. I think you have to have all of them working together to get the best results and results fastest. Like if I'm doing acupuncture and herbs, but you're going home and eating, a diet that's like heavy in inflammation and things like that, it's gonna my acupuncture and herbs aren't going to be as efficient as they could be.
Okay.
So I'll kind of break it down. So first I do acupuncture. So for anyone who comes in with any sort of menstrual irregularities, acupuncture really helps with blood flow. So if you have endometriosis or clotted periods, you need to redirect the blood flow to the uterus. As you get older, your blood flow to your uterus decreases significantly. So this is why periods can change. This is why in menopause you'll see changes, and also why fertility doctors say your egg quality decreases because you're not having that like steady blood flow. So acupuncture is going to redirect your blood flow to your uterus. So that's kind of what I use acupuncture. Acupuncture also helps with hormone imbalance. So there have been studies that will take your hormone levels before an acupuncture treatment and after, and it'll show that your hormone levels actually change with acupuncture treatment. The goal is to get, at least one a week for, depending on what you're coming in for. So I obviously use acupuncture as an acupuncturist, and then I use lots of herbs in my practice. I use my herbal line, Dr. Floyd RX, with lots of my patients, and so it's very individualized. I have a formula for a blood stagnation patient, for a like period patient. So there's that, and then I also do like a lot of lifestyle and diet changes too.
Got it. So you talk about a little bit on the Chinese herbs. So is it like for each and every individual you formulate, particularly for that individual? Is it like, that's what I understood, at least what you said? Or is
if someone comes into me like for painful periods, I have a painful period formula.
Okay.
For like a light period, I have a light period formula. And then if you're working in clinic with me, I may modify it and kind of add like some more warming herbs or things like that based on your tongue and pulse. But what you can get on my online dispensary at drfloydrx.com, it's you pick your based on what your period is like.
Got it. So it's off the shelf, basically. Someone can just. So what are the ingredients? Let's just take one example of like maybe painful periods as an example. So what would be, if someone cannot come for an acupuncture session, especially nowadays, right? So what would be the ingredients? I'm just curious so that our viewers know what the ingredients are.
Yeah, of course. So how I just want to say before we kind of dive into herbs that in China, you have either acupuncturists or you have herbalists. So in the States, combine the two. And so you can work on hormone balance just as effectively only using herbs as only using acupuncture. So these herbs are kind of standalone. So my painful period formula is called Flow. And the main formula that's in Flow is correlates, which is in Chinese medicine, yin hu so. It's an antispasmodic and a pain reliever. And so the goal is to obviously help decrease your pain, but most of the reason why you're in pain is because you have blood stagnation, is what we think.
Yes.
So most of the people who have pain typically have clotted periods. And so a lot of the other herbs are going to be herbs that help with blood circulation. So these are things like angelica, white peony, red peony. We call it bai shao and shir shao. I also have in the painful period fennel. antispasmodic. Licorice.
Fennel, like a spice fennel,
Yeah.
right? Wow.
Yeah.
That's,
So the thought is that like spices help circulate your blood. And so if your pain is caused by blood stagnation, you want to help that like free flow of blood to get out of pain. So fennel, ginger, so like more of these warming spices.
mm-hmm.
And then Correlates is kind of the main one in that. Angelica sinensis helps with blood circulation, so that too.
Wow. So you formulate it here in the United States and make it yourself in your office, all these formulas, right? Or somewhere
Well, I have I've sent my herbal ingredients to a distributor at a warehouse, and they're the ones, they work with Chinese medicine herbs, so they're the ones who formulate it and do all my testing for heavy metals and everything that I can't do myself. So and then it's shipped to the person.
Of course, of course. So what you're saying is acupuncture can be independent of the herbs. That's what right? That's what you said. Like in China, for example, you said if there's an acupuncturist, there's an herbalist, and they can work independent, and specifically in menstrual health. Let's say, a woman or a young girl or whoever is having menstrual issues, whether it's a clotting or a painful, they don't necessarily have to go do both. They can either go acupuncture way or they can go herbal way. Right?
So I have like patients who see me in clinic, I'll use acupuncture and herbs. And then patients who I do virtual consultations with, I will do, just herbs because I'm not there with them.
Yeah.
And patients.
So what are the results? So let's talk a little bit about the results that happen. Someone who's doing acupuncture plus herbs and someone doing only herbs. So the outcome and the results, are they similar or they're a little bit better here and a little bit less here?
Yeah, so I think it definitely depends on compliance. So people who are taking my herbal formulas and not getting acupuncture, you have to take them every day. So as you know, herbs are it's not like Western medicine in that it's like treated. You take it immediately. You have to take it every day. People will notice a change. Some people notice it immediately. Some it takes a couple days. But obviously, once you have your first menstrual period, then we kind of have a check-in and see how everything went, what we think that we need to add or take away. So patients who are just taking herbs, like I had someone I talked to last week who was taking my my PMS formula called Relieve, and she's in Florida, I'm in Sacramento, and she took after 3 days of the herbs, she noticed a significant decrease in irritability. So something can happen pretty quickly with herbs. If you have acupuncture with herbs, acupuncture naturally just really helps with blood circulation. It happens, I would say, maybe a little bit faster. Also, if patients are coming in weekly, I'm holding them more accountable to the changes that they agreed to take when we started working. So that also kind of skyrocket seeing results.
Absolutely. No, I get my acupuncture done regularly, of course, not during COVID times, but it's amazing, what it can do to your body, the detoxification, all the benefits, I think. So it's amazing. So like a lot of women feel irritability, mood swings, during their menstrual periods. So that happens a lot naturally. So do you also recommend kind of calming them down or just let it be from a natural point of view, be irritable, be mood swing or whatever?
Yeah. So, I mean, periods shouldn't be like scary. You shouldn't be dreading the week before your period because you have such a mess. It's always funny because my patients, their partner will be like, please tell your acupuncturist or the herbalist I said thank you because, it's so much more pleasant because you're working on that irritability. So no, I don't think that irritability is normal. It's, how your period works is you have these fluctuations of hormones and hormones. And once your hormones stop, then you'll shed your endometrial lining. So, the hormones also make you feel good depending on where you're at in your cycle. And so having some sort of like emotional change as you go through the ebb and flow of your hormone and your hormone cycle, that some irritability is common, but you don't want it to be anything that like you are angry, you want to punch something, like you have a very short fuse, you don't want to do something that's makes you hard to live with that your hormones are dropping too fast or you're not getting enough of them. And so that to me indicates that I have to work on hormone balance. And so again, I'll do that with acupuncture and herbs.
Got it. So which is the hormone that goes out of whack right now during this time? What is the name of that hormone?
Yeah. So I'll walk you through like a normal cycle. So,
Okay.
cycle
Sure.
one of your period, like your hormones are dropping. So you start your period because your progesterone and estrogen decreases. That
Got
tells the body that like we don't need to send blood circulation or create hormones because you're not nourishing a potential fetus. And
it.
so
Mhm.
you have your period. So typically that can be why you're feeling a little bit low energy on your period, and why your skin starts to break out and things, because
Mhm.
have dropped pretty quickly. Then your hormones start to build up. So your estrogen and your follicle stimulating hormone from cycle day one, so the first day of your period to the middle part of your period, your hormones start building up, and what makes you feel better.
Mhm.
That's what grows your endometrial lining. So the idea is that by growing your lining, when you do ovulate an egg, the egg, if it's fertilized, can implant the embryo and that like plush lining.
Mhm.
Estrogen is going to start making you feel good, start giving you energy. And
Yeah.
when people feel their best is when progesterone kicks in. Progesterone is secreted from the corpus luteum. So after you ovulate, your
Mhm.
your corpus luteum will secrete progesterone. That's what makes you feel good, makes you want to be social. So this is like around midway of your cycle. And
Got
then from there, your progesterone and estrogen grows, hopefully, because your body is like, we may be getting pregnant. We have to start on furthering the endometrial lining. However, if you don't get pregnant, they drop. And that like drop is what is going to start feeling like PMS. That's going to, eventually start the bleeding, the shedding of your endometrial lining. So the goal is to make the drop less, I was going to say less of a drop. We want to make the drop less of a sudden decrease. That causes cramps, that causes irritability. We want to kind of make the ebb and flow more smooth.
Got it. Got it. No, I think this is very well explained. To all our viewers who are watching, feel free to ask questions if you have. I don't know how many women are watching. I can't tell from the stream of people who are joining us, who they are, of course. But if you can't think of any questions, you're welcome to send us the feedback. Anything else you'd like to add, Dr. Carolyn?
Yeah, I mean, so there are a couple things that I think that people like. I always want people to walk away from any talks I do feeling empowered of like how I can start changing my period now.
Yeah.
Some,
Yeah.
like if you don't want to spend money on herbs, you can start making like lifestyle changes now. And so,
Okay.
what I recommend just, to start helping if you have painful periods or irregular periods now is I call it my SEES protocol. So SEES. The first S stands for stress. So working on stress management. And
Mhm.
your Instagram profile talks a lot about stress management. So
Yeah.
maybe through some of the previous ones on stress. Exercise, so moving your body in a way that feels good. When you move your body, you're also moving your blood. So again, for those with pain, I would say going on some walks, nothing too intense on your cycle. But exercise in general will help with inflammation and will help with hormone balance. And then you have eating. So what you're eating, you want to decrease inflammatory foods like fast food, processed foods,
Mhm.
vegetable oils, things like
Yeah.
that. And sleep. So most people who come to me aren't sleeping enough. So if you can change any of those: stress, eating, exercise, or sleeping, that will help you get a better period faster. Yeah. And then other things, just want to drive home that having a painful period or an irregular period means
Mhm.
there's some sort of hormone imbalance or something underlying everything. So you can reach out to me at drfloydrx.com for online consultations, or someone in your area that specializes in hormone balance and women's health, because you should, get to the root of it. You're on your period for 7 years of your life minimum. So this shouldn't be something that you're, really dread and have to stay in bed the week of your period,
Mhm.
like that. So
Yeah, no, I think I was just reading up, in Ayurveda and acupuncture has very similar kind of concepts, right? So Ayurveda talks about that, when the woman has periods, the menstruation happening, they should not do too much heavy duty exercise. So that's one of the concepts that they talk about, that they should kind of relax during that time, 5 days, and not do heavy duty exercise. And that's very kind of like regimented, how Ayurveda is a very kind of have all the things action plan kind of a thing. So does acupuncture or Chinese medicine has this kind of a regimentation of like, okay, light exercise, not heavy, and all that?
Yeah, 100%. So, well, first I want to point out I'm wearing my vulva earrings. So I have on my hormone earrings.
Oh, you have hormone earrings?
I have my vulva earrings. It's a conversation starter, It's definitely, people are a little shocked. But yes, so I talk about it on my profile. I have like a 5-minute video of how to exercise depending in your cycle, but you do. So I completely agree with you. On your period, you should slow down. So I call it slow and solo. When you're on your cycle, like you want to be by yourself, kind of be more introspective on your period. Then after your period, as your hormones are kind of increasing and you're feeling better, you can start with more movement. And then again, as you get closer to your period, you want to slow down again. So it just depends on where you're at in your cycle. But I think overall, do what you feel like you're craving. Your body is going to tell you what you're craving. So if like on your period, most people don't want to go on, crazy intense runs or being like heavy. That'll just make your period heavier. So really like see what your body is craving and do that. And most of the time, that's kind of what Chinese medicine would recommend. It's supporting your body where it's at.
Okay. Yeah. No, thank you so much for being with us.
Yeah. Thank you for having me. I really appreciate it.
Absolutely. Well, thank you so much. And with that, we'd like to wrap up this session. If there are any questions, comments, I saw a lot of people join. So you can, just send us a message or a feedback right on our Insta account and let us know how we are doing.
Yeah.
And thank you so much, Dr. Floyd, for being with us. Bye-bye.